Hey, good morning, good afternoon, good evening, wherever you may be in the world. This is Dr. Dan Nightingale, your clinical dementia specialist, coming to you all the way from Arizona. It's a beautiful day. The sky's blue, the sun's shining. What more could we ask for? So I hope wherever you are in the world, you're having a good day, just like I am. Today's video is going to be focused on kind of engaging activities, things that people can do. One of the things that Amber and I posted yesterday was a statement that said something about getting some engagement through like fiddle tools and fiddle toys and things like that. So I'm going to take you back to right back to early 2000s when I was a clinical dementia specialist, the dementia consultant working in the UK. At that time, I introduced fiddle boards. So if you look in nursing homes in England and in the UK in general, you go into a nursing home back then, and there would be lots of beautiful pictures on walls. And pictures on walls are totally meaningless to people who are living with dementia. They can lose it. Some people can't even see it. They can't even see what the picture is, let alone what the meaning of that picture is. Looks good in the foyer of a nice big hotel, but not in a nursing home, and especially not in a memory care community. So I introduced these fiddle boards, and these fiddle boards were things that we replaced pictures with. So they were things that you could put on the wall, and they had all kinds of different things on them that people could touch, that people could get some sensory stimulation from, that you could communicate about. You could engage in a conversation about these things. So it could be something from the past. It could be things that like tools, sandpaper, hammers, screwdrivers, things like that evoke memories and that also evoke some sensory stimulation. So it's something you can engage in a conversation with, which sounds absolutely fantastic, because that's far better than looking at a picture that looks beautiful but has no real meaning, and there's no interaction or intervention with them. So that was something that people could use. And then we started to introduce aprons. Now, these aprons had things on them that people could play with, that people could engage with. They can occupy themselves, they could get sensory stimulation from. So instead of just sitting there staring into space or watching a meaningless television program, they would have the apron with all these bits and pieces that they could engage with. And again, when somebody communicates and engages in conversation with them, there are things that you can talk about. There are things that evoke memories, things that stimulate the memory. So those were some of the things that I introduced way back when, early 2000, when I first started out as a dementia consultant in the UK. Zoom forward to 2024, and many people around the Western world are using these things now. They're using engaging activities. We have specific things made. Companies are making these things. They provide these tools, these engaging opportunities, and also jigsaw puzzles. They have plenty of jigsaw puzzles that are specifically made for people who are living with dementia. Springbok, who I love. I absolutely love Springbok puzzles. They are amazing. Go on their website and have a look for their puzzles. They're different size pieces, different amounts of pieces, 50 piece, 100 piece, 200 piece, 500 pieces. Easy to manipulate, easier to see, easier to understand. The colours are not too dark. The pictures are not too busy. So Springbok is a great company if you're looking for puzzles, jigsaw puzzles, desktop jigsaw puzzles. So those are the kind of things that you can use to engage people with. And something else that is really important, and as many people will know, is music. Music has so much power as a communication tool, as a vehicle for communicating with people who are living with dementia. Some people who have difficulty with dysphagia, so expressive dysphagia, receptive dysphagia, not being able to express themselves, not being able to understand what that person is saying or what that person is trying to communicate. Well, if you introduce music, then it's a different ball game altogether. You've changed channels effectively. It's like changing over from BBC One to ITV, or from Sky channel to a different TV channel. You've moved something, something's changed. We're not 100% certain where the music centres in the brain actually live. If it's anything like the memory, it's fluid. It moves all over the place. But one thing that really stands out about using music is that if you try to communicate verbally with somebody who has lost the ability to verbalize, you can sing. You can sing. You can sing a song. You can bring in a familiar tune. You can bring in something that they recognize and that they will then sing along to. They might not be able to verbalize in a normal conversation with word, but when it comes to singing and using this musical instrument we call the voice, they can do it. It's incredible. It's amazing. So something else I introduced is called MARTIS. And MARTIS stands for Music and Reminiscence Therapy Incorporating Storytelling. How does that work, you may ask? Well, you can use this in a group setting or you can use it on a one-to-one. And basically, you start a conversation, and that conversation can be around anything that, if it's a group of 6 people living with dementia, get somebody to choose a topic, start the conversation, and then continue that conversation for as long as you can before it dries up. Because inevitably, people will forget and lose the thread of the conversation. At that point, this is when you play some music. And the music has already been pre-selected based on the group's abilities, the group's knowledge, the group's needs, the group's strengths, the group's personalities, and the group's past experiences. So David in the group might be a big Sinatra fan. Jenny in the group might be a big Elvis Presley fan. There might be some Beatles fans. There might be some Led Zeppelin fans. There might be some Thin Lizzy fans. There might be some Ozzy Osbourne fans. You know, there might be Journey fans. There might be Queen, Pink Floyd. All these different pieces of music that people are interested in and that they were fans of before they developed their cognitive challenges. So you would bring in some music and listen to the lyrics and pick something from the lyric that can trigger conversation and get people to sing along to the song, and then stop the song, engage in communication. And you can do the same on a one-to-one. Find, you know, if you know the person, if it's your husband or your wife or your mum or your dad, your son, your daughter, or any other relative that is living with dementia, then you know that person very well. You know what kind of music they're into, what kind of music they like, and so you're already there. If you're a caregiver, a paid caregiver, a professional caregiver who is meeting the person for the first time or the second time, and you're just beginning to establish the relationship, ensure you find out what music they're interested in, what music they like, because then you can use MARTIS to engage in conversation with them. It's a fantastic vehicle. It's a fantastic tool. I remember a lady who used to be an opera singer, and she lived in Wales. She was living in a nursing home in Wales, and she couldn't speak verbally. She could not communicate. She could communicate in other ways, but verbally it had gone. There's a part of the brain called the Broca's area and a part of the brain called the Wernicke's area, and those guys are responsible for speech and language. If those parts of the brain get damaged due to the dementia, then that's what affects people's speech and language. So this lady had got that damage. So we would sing to her, and she would sing a full operatic song, a full operatic piece of music. And she got so much from that, so much meaning to her. So it was absolutely fantastic to see. And over the years, I've used this even in clinical practice. I will sing with patients if they usually cover their ears and say, no more singing. But it's a fantastic medium, and it's a wonderful way to stimulate the brain, because neurologists will always say two things to learn is a new language and a new musical instrument. So music is very, very powerful. So there are some ways in which you can engage with people and communicate with people. One thing to note about those things is don't spend more than 20 minutes on that particular activity, whatever activity that is. So if it's doing a jigsaw puzzle, no more than 20 minutes. Even if the person's enjoying it and really getting into it, 20 minutes is your cut-off point. This is because our average attention span is 20 minutes. And with somebody who is living with cognitive change, that attention span might be much, much less. So no more than 20 minutes, but follow the person. If their concentration is 2 minutes, 3 minutes, and then they start to look bored or disinterested, move on to something else. The same with any of my rule of 7. People who follow me, people who know me, my patients, I introduce and prescribe the rule of 7 to all my patients. And the rule of 7 is we have 7 days in the week and we do something different every single day. So on a Monday, you might learn a new word, a word you've never heard before. So you learn it, you keep learning it, you keep learning it, you keep learning it, you keep learning it until you've got it, until the neuronal pathway is laid down, until the hippocampus has anchored it, and until you can retrieve it and express it. And then learn its spelling, learn its definition, and keep learning until you've got it. But again, no more than 20 minutes in the day, okay? Another day is using non-dominant hand, because that triggers and wakes up a different part of the brain, and it also helps with dexterity, hand-eye coordination, focus, concentration, and those kind of things. So if you're predominantly right-handed, use your left hand to brush your teeth, to brush your hair, to write your name, those kind of things. So those are a couple of really important engaging activities that you can do to engage, communicate, and really make contact with that individual. Okay, that's it. I'm done with those things now, and I'm done with this video for today. So thank you for watching me. Thank you for following me on Facebook and on Instagram. Share these videos, share this YouTube channel with everybody you know, everybody. There are videos, over 200 videos on the YouTube channel now, and each one of them is important. It's a piece of education, it's helpful, it helps everyone. So share it. Come and visit me at my website, drdanielnightingale.com. Contact me through Psychology Today. Contact me through drdan@drdanielnightingale.com or lynn@drdanielnightingale.com. Okay. So there you go. A big shout out to my good friend Amber, who is absolutely amazing and who does some fantastic work on my social media and getting things out there and educating the world. Because the more people we educate, of course, the better it is for everyone. Have a fantastic day, evening, week, and when the weekend comes, hey, make it count. Okay, guys, take care. Bye for now.